Welcome to the media briefing today. The doctors we have today are Dr. Zhang Shukwan, Head of Communicable Disease Branch of the CHP, and Dr. Lau Ka-hin, Chief Manager of the Hospital Authority. Dr. Zhang will tell us about the latest situation. Good afternoon. We have reported 206 PCR positive tests last night, and on RAT, we had 207. The total number of positive cases today is 413. The cumulative number is 1.19805 million cases, including 475, 302 PCR positives, and some, and the remaining are RAT positives. Among the 206 PCR positive tests, 68 were reported by the HA, 25 by the CHP, our own laboratory, and 113 cases were reported by private laboratories. Among the 95 cases, we have performed genome sequencing for 95 cases. 89 were found without the L452R strains. 6 cases were unconfirmed because of low viral load. In the previous case, however, we have found the BA.05 strain. That's a 40-year-old male patient. He had 2 doses of BioNTech. He returned to Hong Kong from South Africa on a QR818 via Doha. That's the 23rd of April. Upon arrival at Hong Kong, he was tested positive and was sent to a quarantine hotel. He had no symptoms and he traveled alone. So that's the second case found with BA.5 strain in Hong Kong. Among the cases today, 24 were imported. 19 were tested positive on PCR test, and 5 cases were found via RAT. 7 cases were arrivals at Hong Kong yesterday from 4 flights. One is CX170. 2 passengers arrived at Hong Kong on QR598. One from another flight and one from ET6. So they were found to be positive between the 2nd and the 5th day, and one arrived at Hong Kong on the 26th of March via TA083. We have received no new cases from residential care homes, from as well as those who have which have reported previous infections. For schools, 10 cases were reported today, 7 from RAT and 3 via PCR test. 9 students and 1 school staff member tested positive. They were unlinked with previous cases from schools. For deaths, the HA reported 5 additional death cases. These patients have been tested positive in the previous 28 days. Altogether, 9,005 deaths in the 5th wave reported by the HA, plus the other cases, and there are altogether 9,074 fatalities in the 5th wave, including 3,741 females and 5,333 males. The other analyses are similar with before, so I'm not going to repeat them. That's all for my report today. Dr. Lau, please. Good afternoon. At present, 1,625 patients are receiving treatments in our public hospitals, North Lantau Infection Control Center, the CHP's Infection Control Center, and the AWE Community Treatment Center. Yesterday, there were no newly reported critical patients, and there are 2 new patients in serious conditions. 11 critical patients are receiving treatments in ICUs, and also 5 fatality cases were reported yesterday, 4 males and 1 female, aged between 60 and 95. Among the 5 deceased patients yesterday, 3 were from care homes, 4 were without vaccination, 1 had 1 dose, 4 patients aged above 65. 1 younger patient was a 60-year-old female. She had hypertension and type B hepatitis, and a low adrenaline level, and she was a terminal stage liver cancer patient. On the 15th of April, in the small hours, she was found to have passed out at home in the toilets for 2 hours. She was sent to the Tokyo Hospital's A&E. She complained of lack of a poor appetite in the past few days, as well as edema, abdominal fluid. She was taken into the Twin Moon Hospital. Since she was a late-stage liver cancer patient, her situation deteriorated and she passed away, unfortunately, yesterday. In the past day, 243 patients have recovered, including 165 discharged patients. So far, in the fifth wave, 47,531 patients have recovered, including 467,900 and 30 patients discharged. So far, 59,915 patients have recovered, including 59,173 patients discharged. And also yesterday, on admission screening and in hospital test, a patient was found to be positive. One patient in the same ward was classified as close contact. For our staff, 22,443 staff members have tested positive. Among them, 22,010 staff members have returned to work. Thank you. Now we will take questions. Please raise your hands and put questions with our microphone and identify your media organization. Thank you. The gentleman at the back. Good afternoon. I'm from Orange News, Leung Hei Yin. Today, the number of new cases is similar with that of yesterday, some 400 cases. So how would you assess the trend? We are going to have holidays, including the Labor Day holiday, as well as the birthday of the Buddha. So are you worried that there will be a rebound because of more activities? And also, an elderly people has passed away during hotel quarantine. So some experts recommend that if situation allows, a discretionary approach should be adopted to allow elderly people returning to Hong Kong to be quarantined at home so that they can be cared for by their family members. Now the situation is rather stable. Is there room to relax the quarantine requirements, and how can we make sure that similar incidents won't repeat? For those who are quarantining alone in hotel rooms, is there enough support for them, and how will we step up supports for them? Will you deploy more manpower to make rounds, or offer means for these people to seek help immediately in the room? The number today is similar with that of yesterday. We don't know the trend yet, whether there is a rebound or not. We have to keep observing. During holidays, people will go out, so it may lead to more cases. We need to observe. For quarantine hotels, if arrivals require special attention, say physical or if they require physical or mental support, or if they cannot care for themselves, they can have family members accompanying them in hotels. Our team will review the mechanism to see where we can do better. Next question, the gentleman in white. Good afternoon, doctors. I'm from Now TV. Now, the reporter just now asked about an elderly people who passed away in hotel quarantine. So are you not going to allow them to quarantine at home?
So is it possible to allow their family member to go into the quarantine hotel and stay with them during the quarantine period, even though they are not accompanying him during the trip? And also for the BA.05 case, we have the second case, and he was found as soon as he went into the quarantine hotel. What about the staff of the hotel? Would there be risk or other risks related to this case? And also, I'd like to ask the HA, because the Chinese U Hospital also said that they would be closing some of the wards for COVID patients later. So for the dedicated hospitals for COVID patients, will some of them be closed as well? And also for the mainland healthcare professionals, well, according to the announcement, will they be going back to the mainland in batches? So what about the impact on the HA? Would there be any impact? And also, what kind of batching would that be? And also, when would they be going back to the mainland? Well, as far as I am aware, for carers, if they are not accompanying the passengers, and if they need special care, they can also apply for family members or carers to join them in the quarantine hotel. That has been the long-standing practice. So whether or not they go into the quarantine center or the quarantine hotels, that would be permitted. And also for the BA.5 case, in fact, he did not go into the quarantine hotel. In fact, he was directly sent to the quarantine hotel. He did not go into the quarantine center. With regard to the Chinese U hospitals closure, well, we are very grateful to the Chinese U Medicine or Medical Center for allowing us to send some of the COVID patients and also for the convalescent patients to go there for convalescence purposes. In fact, at the peak of this wave, some 10,000 beds were turned into COVID beds. And some of these beds were provided by the dedicated hospitals or designated hospitals. With the situation easing off, some of them have already been converted back to the normal use. And as you understand it, during the epidemic or even now, there are non-COVID patients who would also need to be hospitalized for treatment, and therefore some of these beds are now being converted back to their normal uses so that non-COVID patients would also be able to receive proper treatment. And of course, these beds, before they are being used to admit COVID patients, some alteration works have to be carried out in order to ensure that the ventilation would be appropriate for COVID patients. And therefore, for the wards that had been converted, they will still be kept in the event that the epidemic situation gets worse. Then we will be able to reconvert them into COVID wards again, so that COVID patients can then be admitted to those wards for treatment. As regards the healthcare teams from the mainland coming to Hong Kong to help us, we are very grateful that during the past 2 months, about 400 healthcare professionals from the mainland have been here to help us to deal with this very dire situation of the epidemic. Other than the fact that they've been able to strengthen our manpower to cope with the situation, they've also given us a lot of experience. In fact, Hong Kong's healthcare professionals have been having a lot of coordination and exchanges with them, and it's also a learning curve for all of us. Well, with the epidemic situation easing, they would be going back to the mainland in batches. And once again, we'd like to thank them for their help. Next, the gentleman in the front. I'm from .news. Well, recently, some groups conducted studies and surveys, and about 75% of the COVID patients, even after recovery, they also had some long COVID symptoms. So, will you be setting up some centers for these discharged patients? So do you have information about these patients who are suffering from long COVID symptoms? And also, other than very restrictive Chinese medicine services, will you also offer other services for these patients? And also, in the government's information website, it says that, well, the situation is now under control and therefore we're returning to normalcy. So does that mean that the administration is now of the view that the situation is now obviously under control, and for another outbreak to take place, the risk is very low? And also for the social distancing measures, you're relaxing them right now. So does it take further time for you to take note of the situation before further relaxation will take place? Well, we are monitoring the situation very closely. We are monitoring the figures and also for the community testing centers and also the compulsory testing and also restrictive testing and so on. Obviously, the situation is now under control when compared to the peak of the epidemic earlier on. Yes, for patients that have been discharged, public hospitals will also arrange for them to go for follow-up consultation, and different specialist clinics would also be looking at their clinical conditions in arranging for appropriate aftercare services. Other than public hospitals, which are offering follow-up consultation to them, in fact, for COVID or for ex-COVID patients, they would also be able to go to the Chinese medical research and consultation centers for services. And within 6 months after their discharge, they can also go to these Chinese medicine centers for 10 consultations. And every time when they go back for a follow-up consultation, they would also be asked about their conditions. Do they have any, long COVID symptoms and so on. So we would be looking at their conditions and their needs to see if they require more services. The most important thing is we'd like to provide appropriate care for the patients. Next, the lady in checkered shirts. Yes, I'm from Hong Kong 01. Well, I'd like to put this to the CHP for the arrangements for those under quarantine. So once they are arranged to go to a quarantine hotel, will they have to be checked on their personal conditions? Do they have any underlying diseases and so on before they go to those hotels? And also for the elder who passed away in the quarantine hotel, in fact, he complained that he was having chest pains, and his family member tried to take some drugs to him at the hotel. And then the hotel said that they would have to consult the CHP for advice. And when did you receive that inquiry? And when was the medication sent to him? Was it that there was a delay resulting in a delay in getting the drug causing the death? And also, for the second BA.05 case, apparently he was infected in South Africa. So both cases have come from South Africa. Would you be monitoring the situation? So will there be any tightening up of the situation so that flights from South Africa might not be able to come? And also with regard to the prescription of AstraZeneca oral drug, are there any complications, and when would you start to prescribe that drug? I understand that follow-up action is taken by the CHB. According to the CCTV records, on the night of Tuesday, the family member of that gentleman sent 2 packets of medication to the hotel, and shortly afterwards, the hotel staff already delivered the drug to the person under quarantine. Because he called the hotel at around 8 that evening, asking his family member to send him the drug, and then before 9, the drug was already delivered to his room. And we've been emphasizing that the person under quarantine, for example, the hotel should exercise common sense in determining whether or not the request by the quarantine person is reasonable, and there is no need for the hotel to seek consent from the CHP on every occasion. And also, where circumstances warrant, they can always call the front desk or the hotline 2125-133. 1133, and then they could even call the police. So we told them beforehand, and if these people or persons had special needs because of their own health conditions, they can also arrange for carers to stay in the hotel together.
On the AstraZeneca antibody drug, we have dispatched the drug to different hospitals. they would be prescribed to immunocompromised patients. So we are prescribing the drugs to stem cell transplant patients. So we don't have the figure about the number of patients receiving the drug. The point is we are prescribing the drug to immunocompromised patients who are not reacting well to the vaccines, so that in case they are infected, we can lower the risk of complications and even death. Next question. Hi, I'm from Cable News. This afternoon around 1:30 p.m., a member from the mainland medic team passed away in a hotel in Tsim Sha Tsui. So can you confirm that? For 2 days in a row, some people passed away in quarantine hotels. So would you review the situation in hotel quarantine? Now, the actor, Mr. Kenneth Zhang, passed away in quarantine hotel yesterday. So was he infected? And what was his cause of death? Did he have symptoms? How long after his death was he found dead in the hotel? And how often would staff member make rounds for the hotel rooms? Now we have an elderly person passed away in a quarantine hotel. So would you set aside a section in quarantine hotels designated for elderly people? I'm not aware of the other case concerning the elderly person who passed away in quarantine hotel. According to the initial report from the coroner, he was tested. He was negative, and his RAT test also came back negative. The DOH would not check on those quarantining in hotels. However, we require those staying in quarantine hotels to do a RAT every day. On the third day of the quarantine, our contractors would perform PCR tests for those under hotel quarantine. On that day, our contractors knock on the said person's door for a test. However, no one made a response. That's why we were alerted. I don't have the information about that. Next question, the gentleman over there. Good afternoon, TVB. Concerning the elderly person who passed away in a quarantine hotel. Since the fifth wave, how many people have applied for an accompanying person in hotel quarantine? How many cases have you approved? So are you going to adopt a new arrangements, for example, allowing elderly people to be quarantined at home? Now, today we don't have any new cases from residential care homes, and also the number of deaths has climbed down. So would you say that we are on a downward trend, or is there a risk of rebound? Well, there is always a risk of rebound. We have just relaxed some social distancing measures. Schools have just resumed in-person classes. Some kindergarten will resume in-person classes after the 3rd of May. These added together would increase the people flow, and it is expected that there is risk of a rebound. I'm not in charge of approving those applications, so I don't have the number of people applying for accompanying persons. Next question. Hi, I'm from Ming Pao Daily. Now the BA.5 variant. You said that the case was sent to quarantine hotel directly. So for the flight where he where he was on, were there other positive cases? And what are the strains of the cases, if any? Both BA.5 variant cases that came from South Africa. So how would you assess the risk of travelers from the South Africa? And would you perform more frequent genome sequencing for South Africa passengers? And what about the data and the analysis for BA.5 cases? Has the first case recovered? And what about the symptoms? Are they the same with Omicron patients, including the severity of the cases and the time required to recover? For schools, how many schools have resumed in-person classes today? And about the students and staff member who tested positive, how many of them have come back to school? And 3 cases were found positive on PCR. Why was PCR performed for them? Was it because they were returnees? On quarantine arrangements, so what's the major risk or major obstacle to allow people undergoing quarantine at home? Some experts recommend considering the arrangement. So what would be your view on home quarantine? On that flight, as far as I remember, there were some other cases. For all imported cases, if the viral load is sufficient, we would perform genome sequencing for all the cases. Some cases have high CT value and low viral load, so they were tested positive, however, and no genome sequencing was possible. So for those cases we have performed genome sequencing, and there was only that case. There were several cases on the same flight, but they did not all come from South Africa because some of them were transit passengers. According to the WHO's latest information, BA.5 and BA.4 variants might be more transmissible than BA.2. However, for the clinical situation and the severity, there is no obvious difference. The WHO will perform more analysis when more data is available. For the first case, the patient has left the quarantine hotel, and the case has no symptom. Today, 624 schools have resumed in-person classes. For those who had a PCR test, some were because of a compulsory testing. For some, they felt unwell, so despite of the negative RAT, they got a PCR test at community testing centers. Sorry, the speaker is not coming through the mic. So the 3 patients from who were under compulsory testing notices because a PCR is required. Initially, there were some symptoms, but they disappeared very quickly, and the case left the hotel on the 7th or the 8th day. For the first case, the patients had mild fever and coughing. Sorry, the speaker is not coming through the mic. Since a genome sequencing was possible, it means that the CT value is low. The last
Morning Post. Regarding the elderly man who died during hotel quarantine yesterday, did he seek medical assistance? If yes, when did health authorities receive the call? And health experts have said the quarantine policy needs to be reviewed. Dr. Ho Pak Leung said elderly travelers who live in a suitable environment should be allowed to quarantine at home so they can be attended to immediately in case something happens. What's the CHP assessment on such a change to the policy? How many people have died under quarantine in designated quarantine hotels? And for the hospital authority, there's been reports that a care worker from the mainland was found dead at a hotel in Chim Sa Tre this afternoon. Can you confirm this and provide additional information if available? Thank you.
As far as I understand, we have not received call from the person under quarantine. For those who have special needs under quarantine, they can apply to have family members to accompany them during the quarantine period and to take care of them.
Yeah, sorry that I have no information about the case you mentioned.
如果冇其他提問，今日記者會完。
There are no further questions. The meeting is adjourned.